Honorable Chairperson, learned audience, Assalamu alaikum. I'm Dr. Abdullah Masud talking about advanced oral cancer management and its outcome. I'm working in Dhaka Dental College and Hospital, which is about 200 bed and 100 bed for maxillofacial surgery. And in Bangladesh, one of the study has done by MD Akram Hossain sir and his team, which says the oral cancer is the second most common cancer in Bangladesh. And in case of male, the oral cancer is the second cause of the death. And each and every day we face this type of advanced lesion in our department. This is due to the delay. And one study has done by MD Zahidullah et al., and which said the total mean delay is 97 days. So this caused the burden of advanced cancer. And in our study, this is 5 years, this is study conducted from 2012 to 2023, and 175 patients is studied. Every patient is studied at least 5 years. And in our result, the male is dominant, and according to the site, the cheek, then lower gingival sulcus, and then the upper gingival sulcus and RMT is the main site, and maximum tumor is T4A, and nodal status in the clinical after the resection, there is clinically the nodal status was 65% was 0, and 30% is N1 and 5% is N2. So overall staging was T4A is 57%, and T4B is 11%, and stage 3 is about 37%. And in our study, only 11% of the population did not take adjuvant radiotherapy due to the lack of facility. And 24% received concurrent chemoradiotherapy. And 5 years survival, overall survival is 73%, and disease-free survival is 64%. So let's see how we have achieved this goal. This type of advanced T4B lesion, that is masticatory space wine, is involved. So they also seek the best possible outcome, and which may say the most natural looking result. And in lower, if I divided it into 3 parts, there is the lesion reconstructed by the radial forum, and the lesion reconstructed by the fibula and by ALT. So here, this patient used to take the ghoul about 25 years, and we have done extended radical resection and bilateral neck dissection, reconstruction done by the radial forum free flap, and that is the result. And he is running quite good, about 7 years. This is another case, right GB sulcus and cheek, skin is involved, and through excision was done with marginal mandibulectomy, and special type of radial forum flap was designed to make the commissure, and that is the result. Say another case of cheek cancer and mandibulectomy, partial mandibulectomy was done, reconstructed by the radial forum free flap, and she also took adjuvant radiotherapy, and 6 and 5 years is running. She's quite good. So this is a tongue cancer. In tongue cancer, tongue is very special organ, as because it needs for deglutition, mastication, deglutition to form the bolus, So for tongue reconstruction, mobility is important, and for this mobility, we use radial forearm free flap. This is one for dorsum, one for the sulcus, and he is quite good. About 8 years is running, disease-free. It's another case of cancer where we have done the partial near hemiglossectomy. And he also had dysplastic lesion in the cheek. So in radial forearm free flap, we have designed for bilobe flap. One for cheek, another for the hemiglossectomy defect. And, sorry. And his mobility is quite good. Tongue mobility is quite good. And in case of, oh, sorry. In case of floor of the mouth, here three-dimensional resection done with suprahyoid muscle and mandible and everything. And it was reconstructed by the fibula flap. And patient is quite good now. Also received the adjuvant therapy, adjuvant radiotherapy. It's a case of recurrent ameloblastoma, ameloblastic carcinoma. She was operated 8 months back. Then again recurrence, where the infratemporal fossa and skull base is involved. You can see in the CT scan. And total compartmental resection was done with mandible and maxilla, and it was reconstructed by the fibula to make her contour very good. And it's another case of GB sulcus tumor involved the skin, so through and through defect. And this defect is reconstructed by the fibula flap, and this is the outcome, and she is very good. About 5 years is running. And when the gap is, wound is very large, then we have to think about the anterolateral thigh flap, because there are lots of tissue and bulk of tissue we can add. So it's a cancer in the right side. Huge compartmental resection was done with the mandible, maxilla, and the masticatory space. And 7 years is going without recurrence. She is quite good. She only received the adjuvant radiotherapy with the surgery. This is another case of GB sulcus with involvement of the skin, and mandible was resected. And this is the defect, and anterolateral thigh flap taken 15 by 6 centimeter diameter, and through and through defect was covered. And it is about 6.5 years later. So this is a T4B lesion where masticatory space is involved. Compartmental resection was done. And in a team of Nirav Trivedi, they showed that the compartmental resection is given the very good result. And in our cases, we have achieved 5 years disease-free survival of this patient. It's another case of masticatory space involvement, and the compartmental resection was done and reconstructed by the ALT, and he is quite good. This is a defect at the donor side, and this is the result. So in conclusion, the oral cancer is a major problem with large burden of advanced cases, so need multidisciplinary approaches, and single modality treatment for early stage and combined modality for advanced stage. And the compartmental resection has given the promising result, and salvage for advanced disease has satisfactory outcome. So this study indicates that with surgery followed by adjuvant radiotherapy may deliver better outcome and survival for advanced oral cancer patient. So I must acknowledge my teammate and my family. And again, I want to recapitulate, in our advanced cases, we have achieved 73% overall survival and 63% 5-year survival, disease-free survival. Thank you everybody for patient sharing.